According to the treat-to-target paradigm, the treatment of rheumatoid arthritis should be adjusted as needed to achieve remission as soon and consistently as possible. Following the Boolean definition, remission is assessed through the number of tender and swollen joints, together with C-reactive protein and patient global assessment of disease activity. All should be at the maximum of 1 to achieve full 4-variable remission. In a recent meta-analysis, including over 23,000 patients in clinical cohorts, we have shown that about 12% of patients were in 4V remission status. However, 19% of all patients with RA did not achieve this status solely because of a PGA score higher than 1. This so-called PGA near remission status represents 60% of all patients with RA who are otherwise in remission. These patients are exposed to the risk of unjustified overtreatment because their condition cannot obviously be improved by additional immunosuppressive therapy. This would only be justified if PGA scores higher than 1 were associated with a higher rate of structural damage in patients that are otherwise in remission. The aim of this study was therefore to compare the radiographical damage progression in rheumatoid arthritis patients achieving full Boolean remission versus those in PGA near remission. The only difference between the two groups is that the latter one has a PGA score higher than 1.
We used individual patient data meta-analysis from 11 RCTs, totaling near to 6,000 patients. We closely followed the methods employed by the ACR committee that established the current provisional definitions of remission. We found that 90% of all patients achieved PGA near remission and 23% reached full Boolean remission. The two groups had similar rates of good radiographic outcome at around 80%. This means that including PGA significantly reduces the rate of remission from 42 to 23%, advising the need for additional immunosuppression, but does not change radiographic progression. A sensitivity analysis showed that there is no correlation between PGA and radiographical progression among patients in PGA near remission. This suggests that PGA might, and perhaps should, be excluded from the definition of remission, leaving a 3-variable definition for consideration. We then compared the predictive accuracy for good radiographic outcome of the 3-variable and the 4-variable definitions. None of them was very accurate, but the definition without PGA showed a statistically better predictive accuracy, 51 versus 41%. In order to follow closely the design of the original ACR paper on the definitions of remission, we performed similar analysis looking at function measured by the Health Assessment Questionnaire. As expected, the full 4-variable remission was associated with significantly better functional outcome than the 3V remission. This was not, obviously, a reflection of disease activity or radiographical progression.
In conclusion, these results indicate that excluding PGA from the 4-variable definition of remission does not decrease its ability to predict good radiographical outcome and may avoid overtreatment. The relationship between PGA and function favoring the 4V remission definition is biased by the fact that both these parameters are driven by common subjective factors, mostly unrelated to disease activity, with emphasis on pain and fatigue. This study suggests that the 3-variable definition provides a more accurate representation of effective disease control and deserves, therefore, consideration as the prime target for immunosuppressive therapy. This evidence supports the proposal for a dual target strategy in the management of rheumatoid arthritis. A target focused on the disease process with a 3-variable definition would be used to guide immunosuppressive therapy. A separate but equally important target would be based on patient-reported outcomes and focused on achieving the lowest possible disease impact upon the patient's life. This will frequently require adjunctive therapy interventions even when the disease is already otherwise in remission.